Did you realize that this week is National Men's Health Week, Jackie?
And we want to introduce you to a doctor who's joining us in studio in just a matter of moments. Let's take a look at Dr. Dennis Zachary.
My name is Dennis Zachary. I'm a family physician and I'm located on the south side, 6601 Southwest 9th, Mercy South Clinic. Family medicine just kind of fit my niche because of the interaction with families and interaction with patients and getting to know people through a lifetime, the different variety of things that you get to do as a family physician. As I was doing my rotations in medical school, I really enjoyed the doctors that I worked with in family practice, and I really liked the whole idea of being around and knowing the entire family from, as I say, womb to tomb. I've been practicing the South Side for 30 years, so obviously I like it. Des Moines is kind of special because it's kind of a small town and large city at the same time. The people on the South Side are really appreciative of the service that you provide for them, and so that's always been my appeal. I think I've just done a lot of things here on the South Side, working with the high schools that I've worked with, working with young people that I've worked with, and have just kind of come to grow, and I love the South Side of Des Moines. A professional football player, of course. If I could do something for one day. Oh, there's a lot of things I would like to do for one day, but medicine is what I like to do the best. But if I had to do, I couldn't pick one thing. I would have to do something with sports, so it'd be football would be one, be a professional football player, and playing in the Super Bowl for one day. I would take that one, give me a Super Bowl ring. I don't do a lot of things besides, if you can find me in very small circle. I go see patients, I'm either at the hospital, I'm here, or I'm around family, or I'm at church. That's kind of my circle of things that I do. And I like to work out, so I like to lift weights. So you can find me at the Y, you can find me around my family, you can find me at some sporting event like a Dolly football game or something, or a wrestling tournament of some sort. I think if I wanted to travel anywhere in the world, I would go where my wife wanted to go. And that's the location I would go. And if she sees that, it's a good answer, so she'll like that answer.
There you go, an inside look at the fabulous Dr. Dennis Zachary, who is joining us this morning. Thank you so much for
Dr. Zach, thank you for being here. Men's Health Week is upon us right now, and that's what we want to focus on a little bit today, is how important it is for guys out there, because we all know how difficult it is for guys to go to the doctor, either for a regular checkup or just if they're not feeling well, and you've experienced that as well.
Right, so there's actually two groups you got to look at. You got to look at the young men, and you got to look at the older men. And where's older men start?
Yes, that's
at about 35, 40.
35 or 40
yeah,
is older?
That's older men. Older
Wow.
men will classify at that point in time. Younger men, basically what you want to do is just get your screening stuff done, get your vaccinations up to date, make sure that you don't have some underlying disease like hypertension that might need to be treated.
Okay, so what kind of screenings are we talking about?
Physical exam, we cover it. So if you go to your doctor, get your regular physical exam, they'll check for vaccinations, and then they'll talk to you. And then what I usually tell my young men when they come in to see me, I go, you'll be fine as long as you don't do something stupid, okay? So don't drink too much, all right? Wear your seatbelt, put a life jacket on when you're on a boat, go swimming where there's a lifeguard, and just be smart, and you'll be fine. Watch what you eat, because you get good habits. We'll start then. And then regular exercise is good for all age groups.
How often do we have to get a physical?
It depends upon your age. I'd say anywhere between every couple of years.
Every couple of years.
Say if you're a guy and you're 30 years old, every couple of years.
Every couple of years would be fine.
Okay, so if you're in that younger category.
Okay, if you're a guy and say, I'm just going to pull a number out of the hat, say he's 57 years old.
Healthy male would still be every couple of years.
Every couple of years.
Yeah,
okay.
If you're a healthy male, you're every couple of years. So then let's say you're the over 40 group. Now the big thing for the over 40 group and all age groups is regular exercise. It trumps everything.
Really?
Yes.
How much is regular exercise you talking about? Are you going to the gym for an hour a day or
30
what?
minutes would be fine.
30 minutes?
Yeah, you do better the more you exercise, but your bang for your buck gets less. So if you look at it kind of a curve, you start a little bit of exercise, you do good, and then these guys out here like me who are working out an hour and a half a day, you get about that much benefit from that extra hour I put in.
Okay.
So you just really need that 30
you just want
minutes.
to get your heart rate up?
Heart rate up. Generally what they recommend is 3 to 4 days a week of cardio, a couple days a week of strength training.
All right.
Okay, and that's all ages that you see that benefits there as a doctor.
Particularly when they do the studies, it's from 40, as most of the studies are done from 40 and over. You have a 50% reduction in all-cause death over a 5-year period, including cancer.
Really?
Just
by staying active?
Just by staying active. The funny thing about exercise is you can't store it up. So you get a guy like me who's been exercising since he was a little kid all the time through. I should have stored up enough in the bank. I shouldn't have to exercise the rest of my life.
Yeah, you should be done.
But it's only good while you exercise, and the body deconditions in 30 days. So it's only good while you do it. But
it deconditions. Say that again.
Your body will decondition in 30 days. Any athlete will tell you that. If they sit out for 30 days, they sit out for 30 days, and you don't recondition in 30 days. It takes longer than that to get it back.
Absolutely.
Wow.
Well, like you said, you're waiting for that Super Bowl call.
That's right. I keep training down, waiting for him to call me. Belichick, give me a call. I'm ready to go.
Yeah, he says Super Bowl. He'd probably be the best one to get a phone call for. What position would you have played if you said you want to play football? What position?
I'll play any position they put me in.
It doesn't matter, right?
It doesn't matter to me.
As long as you get a ring.
Well, that's right. A lot of they get a ring.
That's the deal. Now let's talk about something else here. We want to keep it. I know we're going to go along, but so what? I want to talk about some numbers because it's really important for some of the numbers, the guys to keep in mind. For example, we've heard so many different numbers when it comes to blood pressure. What are the numbers we are looking for blood pressure?
Blood pressure has changed. It fluctuates all the time. Basically, over time, if you look at it, less than 140, over 90 has always been the gold standard as it's fluctuated. But the lower the better. So ideally, you'd like to be less than 130 over 70 for your blood pressure. But you wouldn't get treated if you were running 140s.
Okay.
But if you're running 150s, you need treatment.
Okay, let's talk about that older gentleman category that we were talking about before, because we were talking physicals before, just making sure you have that communication with your doctor, you know what's going on with your body. But as we get older, there's some things we want to be thinking about screening-wise as well. What would be some of those key points gentlemen need to be keeping in mind?
Blood pressure, cholesterol. Now remember, I'll come back to cholesterol in a minute. And diabetes check. And then the cancer screening, okay? So colon cancer screening starts at age 50 and above unless you have a family history.
Okay.
If you're a smoker, there's a screen for lung cancer. You should quit smoking though. That's the big one.
That's an important one.
But let's say you were an ex-smoker like 15 years ago, but you have over 20-pack year history, so you smoked a long time, but you haven't smoked for the past 10 years. You should still get screened for lung cancer. There's a CAT scan lung cancer screen over 55. And that's a good one. And then prostate cancer screening has been all over the board, and it's changes all the time. And I won't talk about it because nobody has figured out where to go with it. The blood test has kind of fallen out of favor.
Oh, it has.
The rectal exam is kind of in there. I mean, what I generally do is I talk to the patients. I tell them about the controversy about it and whether they want to be screened, and about half of my patients will be screened. The other half say, too much controversy about it, I'm just going to forget about it.
Now, what should someone look for, since we're talking about prostate and being checked there, what are some of the things that we should be alerted at? If you're a guy that you say, maybe I need to get this checked out, because we've had a couple of friends recently that have had the surgery for prostate, and they were alerted to some things. But what are we looking for?
Well, generally, with most of the cancers, we're talking about screening, you have no symptoms. And so that's
no
the reason,
symptoms.
That's the reason why you want to be screened, because you want to be screened before you develop symptoms, because when you start developing symptoms, then the disease is spread. So for example, colon cancer, you want to get a polyp off before it turns to colon cancer, before you start having rectal bleeding, before you start having problems with stomach ache and stuff like that. So from screening purpose, you want to get it before you develop symptoms. Okay. And that's the advantage of going to the doctor every 2 years. They can go over, what is recommended, why you should consider doing whatever you consider doing.
Now, you mentioned colon cancer here. We're going to jump around here a little bit, and you say get a polyp off sooner rather than later before it starts developing into something else. Right. How often are you saying to get the colonoscopy, for example?
It depends what screening you want to go with. They got this new one called the Cologuard, which was designed out of the Mayo Clinic. It's the genetic testing for colon cancer and colon polyps, and it's pretty good. and you don't have to do a prep, and you don't have to.
Is that the one you mail in?
Yeah, it's the one you mail in.
Okay. I'm sure the post office loves that.
The whole problem with that one is we don't know exactly how often it needs to be done.
Okay.
And then the other big one is if it's positive, then you have to go to colonoscopy. And then the real question is when you go to the colonoscopy and they didn't find anything, but yet you had genetic information that would suggest that you have a cancer.
So that could be lurking somewhere. We don't know.
So that's kind of in its infancy. Time will tell what to do with that.
But the important thing is to get that screen done.
You should do some screening. You should do some screening, and it doesn't matter which one. Colonoscopies every 10 years.
What do you say to a guy who's like, I'm tough, I'm fine, I don't need to go to the doctor? What would you say to that person?
Regular exercise, if that's what you want to do. If you're going to live your life like that, regular exercise. I would recommend that. I think that if you love your children, you love your family, and you want to be around to see your grandkids grow up, you should probably make sure that you don't have something else going on.
Absolutely.
And you should probably try to prevent it. But if you absolutely refuse to do any of that, regular exercise. Remember that trumps everything, 50% reduction. I can't give you a 50% reduction of all-cause death coming in to see me.
You can't prescribe something to give that kind of result.
Cannot do it.
Okay.
Amazing.
So that's the big one. And so then the other one is cholesterol. I told you I was going to come back to
yes,
that.
you are.
Right.
So cholesterol is interesting now because they have come to what's called a pooled cohort, which is an equation that determines your chances of having a heart attack in the next 10 years. And so now when I bring patients in, I go, we're not treating numbers, we're treating people. So you're more concerned about whether or not you're going to have a heart attack, not what your cholesterol number is.
Correct.
You could care less what your cholesterol number is as long as you're not going to have a heart attack.
Correct.
All right? So they actually have an equation where you put your cholesterol number in, they look at race, sex, age, what your total cholesterol is, what your good cholesterol is, what your systolic blood pressure is, whether you have high blood pressure, diabetes, or smoking. Smoking increases your risk by it doubles your risk, so it's a 100% increase if you smoke. If you look at it, and I plug smokers in, when I plug them in, it doubles their chances of having a heart attack in the next 10 years by being a smoker.
That is absolutely amazing.
And I've had some patients, you'll love this one, I've had some patients that say, if you quit smoking, you don't need to go on a cholesterol-lowering medicine, which is a statin. You don't need to go on cholesterol-lowering medicine if you quit smoking. And they'll tell me the pharmacy to send their medicine into.
No way.
Honest to God.
Well, as you said, you're treating people
Amazing.
as opposed to numbers and things like that. If people would like to get more information, because you're giving us a lot this morning, and they want to talk more with you, how would they be able to do that?
Well, I'm a hard guy to get
I bet you are.
No, you seem like a cool dude. If you're a guy, you're the kind of doctor you want to go to.
But I'm in Mercy South.
Mercy South.
You can speak the guy's language.
Yeah.
You can talk a little football and then talk about your health.
Definitely got to talk about football. That's all. Football. I'll talk to you about wrestling too, although I wasn't a wrestler, but all my sons were wrestlers.
Yeah.
Oh, there you go.
And I have a son who coaches youth wrestling. And I have a son who wrestled for Iowa Western, wrestled in the Junior College Nationals, took second.
Awesome.
Two-time state champ.
It's incredible.
So, but I'm mostly a football guy.
All right.
All right.
All my boys all play football.
What team?
What was my favorite team?
Yeah.
I bleed purple.
Oh,
bleed
okay,
purple.
there you go.
Yeah, Vikes,
All right, so
Vikes all the
Viking
way.
fans all the way. There's nothing wrong with that. That's awesome. Again, you are amazing. You're a heck of a personality, and what a knowledge base you have. It is great. Again, it's Dr. Dennis Zachary, Dr. Zach, as what we're calling him. He is awesome. Thank you so much for being here.
Thank you for being here.
And again, folks, check him out. Done Mercy on the South Side.
Well, we always say, what was the saying back in the day? Man up, go to the doctor, and if you find one that you really enjoy hanging out with, it could change your life and your family's life.
And this is the doctor you want to hang out with. This is a cool dude right here. Wonderful. Thank you so much.
Thank you for being here today.
All right.
All right.
Appreciate it.